as we know it, today is the World Preterm Day. It simply means that a baby born before the end of 37 weeks of pregnancy. So how much do we know about the situation and how do we manage it? In the following report, Hannah Ontame of our health desk speaks to experts.
First-time mother Matilda Mensah was at work, happily rubbing her belly. She was 28 weeks pregnant at that time. Hours after having some time with her baby in the womb, she saw her feet swell, her vision blur, and experienced some stomach ache. As a nurse, doctors in her facility immediately attended to her, but then they had to rush her to a better equipped facility due to her condition. Matilda will get to know upon reaching the hospital that she had to undergo an emergency cesarean session to keep her alive.
All what they were saying is, we have to save you, we have to save you. They were not mentioning the baby, so me, I was thinking I'm not going to get the baby.
Matilda, however, woke up from a deep sleep to be told she had a baby girl who was alive and receiving treatment at the NICU.
In fact, when I met her, I thought she would not survive because she was very tiny, very, very tiny. So I was asking myself, how will she survive through that weight? She was 0.8.
Though the daunting task of caring for a preterm has taken a toll on her, Matilda is grateful to have a huge support system, something she wishes for every mother with a preterm baby.
To take care of a premature baby is really stressful. Yes, my husband really supported me. Yes, I'm happy he didn't leave me behind, he supported me.
This is what Pediatrician at the Shai Osudoku Hospital in the Greater Accra region, Dr. Mamiya Bafo Iwa, has been advocating for. According to her, supporting families, especially mothers with preemies as they are usually called, goes a long way to boost their morale.
When you have a mother in your family or community and then they come with a preterm baby, this is a distressed mother. They need support. So people shouldn't come and have a look at the baby and say, hey, this is a tiny baby. No, because they grow very fast, especially when you keep them in the kangaroo mother care. Very soon they are grown and nobody even knows they were preterm. So if we don't support them and then we rather mock them in a way, it doesn't help because you don't know the next time be your turn or that of your child. So we should support them when they come home.
Global statistics by the World Health Organization reveals about 6 to 10 out of 100 babies are born preterm. In Ghana, the survival rate is between 65 to 80%. Dr. Bafwewa, who believes this is dependent on the availability of required machines needed for their care, outlines some of the complications which causes the death of preemies.
Some of them include day bleeding during delivery or having other birth injuries. Some can die from a low blood sugar, what we call hypoglycemia. And because they cannot store food, then they have those. Others too can have hypothermia. They become cold. You know, we adults, even when we are cold, we want to cover ourselves into the side of the bed. And so some may become cold and die. Others too, when they are very preterm, then hypoxia can also kill them.
She adds, though most premature babies do not experience deformity, there are survival measures that mothers must adhere to ensure steady developmental growth.
We have some mothers, they never come for antenatal clinics and then they just present. And then such mothers are also, or they have the potential to use herbal medications and other things. They do other things, taking alcohol and all that, and all those things predispose to prematurity. So a mother who doesn't attend antenatal clinic has a higher chance of delivering a premature baby, and that is very true.
Selina Bintum, mother of 7-year-old Ken, who was born premature, is founder of the African Foundation for Premature Babies and Neonatal Care. Her foundation has supported several mothers with premature babies across the country with counseling and needed items for care of their preemies, among others.
there are 4 critical players in the survival process. We have the parents, the patient, we have the community, government, healthcare professionals. In no way should we put one player above the other. We have equal responsibility. And so being able to inform the public, prepare them enough, let them understand that these babies can and do survive.
Reiterating the measures outlined by Dr. Bafwewa, Selina Bintum and Matilda Mensah are all advocating regular attendance of pregnant women to antenatal. Preterm babies are born earlier than their gestation period. However, they are just like normal children, and advocates want them and their parents to be treated as such. For Joy News, I am Hannah Odame.
And of course, as we mark the day, it's time for us to expand the conversation and try and look at how we could be increasing investment into the sector. Well, Selina Bintum is founder of African Foundation for Premature Babies and Neonatal Care. Selina, it's good to have you here on The Pulse.
Thank you.
Of course, as we mark the day, World Premature Day, I'm sure that there's a message, a call to action that you're putting across. What's the message?
Well, first of all, I would like to say thank you for giving us the opportunity, because this is what it means. It means that we are empowering parents and patients. We are educating more people and giving an opportunity for the discussion around this sensitive topic to happen. So if you care to know about the AFPNC, so it is a Pan-African, the first Pan-African organization that's established to represent the interests of parents and patients, and also working with healthcare professionals and the scientific groups and key stakeholders to address the issue that affects newborns, especially when they are born sick, small, or preterm or too soon. It started from my personal experience, as the documentary showed. My son.
Yeah, we saw the story.
Yes. My son was born preterm when he was just 6 months into my pregnancy. My water broke. Now, I was a healthy pregnant woman, but then when this happened, the doctor wanted to induce labor. However, the midwife advised against his directive and said, let's perform an emergency surgery. That is what saved my baby. Wow. What happens that because I was losing the liquor, the amniotic fluid that protects the baby in the womb, and that if not for the midwife, because during the procedure we realized that he had tied his umbilical cord around his neck twice, which meant that if the doctor had gone ahead to induce labor, this baby would have been strangled in the process of delivery. So my journey through prematurity, nurturing him, my journey through nurturing him as a premature baby in the NICU inspired me to do extensive research into the issue of prematurity. Who else is going through this? Why is this happening to us? And even questioning my competency as a woman and the trauma that I was going through and how that is impacting my care for my baby as well. That made us realize that the government will be limited in the sense of advocacy can do. It cannot fight against itself. Healthcare professionals do amazing work on our babies. However, they are also limited because their focus is providing care for the baby in the NICU. Now, we need to be a third force that will work with these key stakeholders and other key stakeholders who address the issue. And so we focus a lot on our advocacy, raising funds to support our projects and other projects within the space, improving standards of care and strengthening stakeholder partnership. So the aspect of advocacy is why we are here today. Right. Why? Because there are two aspects of advocacy: empowering with knowledge and also working to influence policy formulation and changes. Now, if we are able to influence policy change, it means that, I don't know you have a hometown, I'm sorry, but my hometown, right, any baby that is born in my hometown possibly will receive the same quality of care like the baby that is born in the city and has access to rich standard of care and also in Kolibu, for example. So why is this important? Like the statistics indicates, globally is a leading cause of death. And what we realize is that even though neonatal mortality rate is about 47%, account to under 5 is 47%, globally, prematurity takes about 16% out of the 47%, is a leading cause. Right. In Ghana, it is same. And many live with lifelong disability. So this particular year, we are asking government to increase investments in newborn care. Right. How? Improve infrastructure in the neonatal intensive care units so that costs of oxygen for a baby, for example, will be reduced. Currently, in some facilities here in Ghana, it's 10 Ghana cedis per hour. For 24 hours, 240 Ghana cedis.
That's how much it will cost you.
That is how much it is going to cost you. And so by 7 days, remember, breathing, ability to breathe on your own is one of the key things, challenges that affect babies, preterm babies, and so they die. And so if, imagine that this is going to take, the baby will need, especially under one, like Matilda's situation, the baby is below 1 kilo, around 800 grams. This baby needs help and needs to be on oxygen. And so if Matilda's baby is going to stay there for a month, multiply this, and they have to be on oxygen during this period, multiply this by 31 days.
That's really a huge cost.
Over 6,000 Ghana cedi per the calculation that I have done.
We'll talk about the way forward, but I just want to pick up on something you said earlier about being the third force. Yeah. So where do we build that coalition from? Of course, you're doing something from your side, but there's more help that we need just to push that advocacy.
Oh, yes, thank you. I mean, in Ghana, I have to say this, to be honest with you, that there has been so many challenges. I mean, we've achieved major milestones. We completed 44 projects in the last 7 years, reached out to over 200,000 babies and families through our partnership with organizations and institutions that have believed in the vision. It wasn't an easy road. Somebody had to believe in this vision for the parent-patient community. And this has empowered us to be able to do more. Now, what would happen is that in the face of the discouragement, I have to be honest with you that meeting certain aspects, technical aspects within the Ghana Health Services gave me hope that we can make a change. Like the former Director Generals and the current Director General constantly opened their doors, and the immediate past Director for Child, Dr. Isabella Sego-Moses. Fantastic people who have given us the opportunity and given me a table. I mean, I serve on the some of the national committees on advocacy and communication in the Ghana Health Service, and I appreciate that because it gives us a seat at the table. At the Global Funds, I have the opportunity to serve as a Parents Advisory Board for the European Foundation for the Care of Newborn Infants. It gives me a seat at that global table to influence policies and understand the change, the trend, and be able to be a better advocate. I mean, professionally, by God's grace, I am competent to lead this portfolio. However, as a mother, I have to learn to wear my sleeve and also learn how to lead strategically to be able to see what resources can we use to hire experts. And I insist to be able to push this advocacy that I'm just ranting about right now. It will not just mean you have to be a pretty face and say, no. You need to hire people with the expertise, the technical know-how to meet these experts in government, to be able to appreciate policy documents. You don't need, you don't need a pretty, you have to be beautiful and smart. But I mean, hey, you need to be able to, you need the substance to bring the experts on board to do this. So it's a long journey. Continuous investments in parents and patient organizations like the AFPNC would mean that we are actually preparing the future to make sure that our babies can survive, because we have nothing to lose when we call out the government for good or the bad. We have nothing to lose if we call out maybe the healthcare community if something had to be done and is not done right. But then we also have the opportunity to work together with them as key stakeholders to ensure that every baby everywhere in Ghana receives the best possible start in healthcare.
Till date, are you still facing the challenge of misconceptions about preterm babies?
Oh yes, I have an experience. I remember when I brought my baby home, my neighbor's son, who usually would come to the room sometimes, he entered into the room and he saw my baby. I mean, listen, my baby was 1.4 kilos. The boy ran back to the mother and said, I have seen Auntie Selena's baby. He has a little small face, small eyes. And that was a child talking. But the mother saw me and laughed and said, my son came and said, your baby has a little face, little nose. And I couldn't believe a mother would encourage this from a child and would not show some concern. And so many mothers that I met, I've interacted with over hundreds and thousands of mothers in the line of my work in the last 7 years. I have to be honest with you. There are many babies that are abandoned in the NICU because they have been rejected by their parents or the families, but they don't understand why, because of the stigmatization. So one of our key responsibilities is to continue working with stakeholders to make sure that we increase awareness on this subject. This is why this one should not be the last time POS will engage us on this. Do you understand?
We'll have the conversation again.
You agree? Because if we stop the conversation ends. But if we intentionally, and I'm so grateful to the multimedia group, I have to say, that they opened their doors to engage the parent-patient community, and it is empowering us to be able to make our voices heard during a sensitive important day like this.
All right, then. We need to go, but just 30 seconds for my audience. What will be that special message to them?
Oh, I would say that today, the celebrities for today are our preterm babies that have survived, and also the parents and the healthcare professionals. Listen, we've met healthcare professionals who are wearing their hearts on their sleeves, going every day to make sure that they go the extra mile to make sure that babies survive. This day is for you. It is about you. And for AFPNC, these are the celebrities today. We say that let's government increase investments in neonatal care so that every baby everywhere will receive the best possible start in healthcare.
Indeed, and that's the call to all of you. You're still watching The Pulse here on the Joy News channel. We'll be back shortly. Please stay.